This vaccine, Recombivax Hb Syringe, is used to help prevent infection from the hepatitis B virus. Hepatitis B infection can cause serious problems including liver failure, long-term hepatitis B infection, cirrhosis, and liver cancer. Preventing infection can prevent these problems. The vaccine is recommended for people of all ages, especially those at an increased risk of getting the infection. Those at an increased risk include healthcare personnel, lab workers who handle blood and patient specimens, police, fire and emergency medical personnel who give first aid treatment, hemophiliacs, dialysis patients, people who live with or spend much time with people with long-term hepatitis B infections, people with multiple sex partners, men who have sex with men, sex workers, injection drug abusers, and people traveling to high-risk areas. This vaccine works by helping the body produce immunity, through antibody production, that will prevent you from getting infection from hepatitis B virus. It does not protect you from other virus infections such as HIV, hepatitis A, hepatitis C or hepatitis E, and HPV. Vaccines may not fully protect everyone who receives them. Before you receive the Recombivax Hb Syringe vaccine, make sure to read all the information provided by your healthcare professional. If you have any questions, be sure to ask them. Typically, the vaccine is given as an injection into a muscle, such as the shoulder or thigh, by a healthcare professional. If you have a bleeding disorder, the injection may be given under the skin instead. Your healthcare professional will provide you with a vaccination schedule, which usually involves a series of 2 to 4 injections. It's important to closely follow this schedule for the vaccine to be most effective. If you have a fever or are unwell at the time of a scheduled vaccination, your healthcare professional may choose to delay the injection until you are feeling better. The dosage and vaccination schedule will be determined based on factors such as your age, medical condition, risk of hepatitis B exposure, and the specific brand of vaccine being used. If you are receiving the first hepatitis B vaccine injection at a time when your healthcare professional believes you may have been exposed to hepatitis B, you will also receive an injection of hepatitis B immune globulin, HBIG. This provides immediate protection against the virus, but the antibodies only last for a few months. To ensure long-term protection, it's crucial to follow the vaccination schedule for the hepatitis B vaccine exactly. Some common side effects at the injection site and general symptoms like fever, headache, tiredness, sore throat, nausea, diarrhea, loss of appetite, and dizziness may occur. If any of these effects last or get worse, tell your healthcare professional promptly. Rarely, some people experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears just after getting a vaccine injection. Tell your healthcare professional right away if you have any of these symptoms. Sitting or lying down may help, since these symptoms usually don't last long. Remember that this medication has been prescribed because your healthcare professional has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your healthcare professional. Contact the healthcare professional for medical advice about side effects. If you experience any adverse events, you may report them to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967 in the U.S., or to the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018 in Canada. Before receiving the Recombivax Hb Syringe vaccine, it's important to inform your healthcare professional about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have a current illness with fever. If you are a hemodialysis patient, you may not respond as well to the vaccine and will need to have hepatitis B antibody levels checked yearly. If antibodies drop too low over time, you may be given another dose of vaccine. People with immune system disorders or older adults may not make as many antibodies to the vaccine, so it's important to discuss this with your healthcare professional. For pregnant women, the vaccine should only be used when clearly needed, and it's important to discuss the risks and benefits. It is also important to consult with your healthcare professional before breastfeeding, as it is unknown if this vaccine passes into breast milk. Remember to talk to your healthcare professional for more details. It's important to be aware of potential drug interactions when using Recombivax Hb syringe. Certain medications can affect how this vaccine works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your healthcare professional. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. If you need to receive other vaccines at the same time as the hepatitis B vaccine, make sure they are given with separate syringes and at different injection sites. This can help to ensure the effectiveness of each vaccine. Recombivax Hb syringe is used to help prevent infection caused by the hepatitis B virus. It works by helping the body produce its own protection, antibodies, against the virus. This vaccine is usually given to people who are at least 18 years old and who are at risk of coming into contact with the virus in settings such as healthcare facilities, emergency situations, or through personal lifestyle choices. Recombivax Hb syringe is given as an injection into a muscle. The vaccination schedule usually consists of 3 doses, with the second dose given 1 month after the first dose, and the third dose given 6 months after the first dose. It is important to receive all recommended doses to get the full benefit of the vaccine. The best time to take this vaccine is when it is recommended by a healthcare professional. This vaccine may not fully protect everyone who receives it, so it's important to keep track of your medical appointments and consult your doctor for more details. Lab and medical tests may be done while using this medication, such as hepatitis B antibody levels. It's important to keep vaccine records for yourself and your children, and provide their records to them and their healthcare professionals when they are grown to prevent unnecessary revaccinations. Make sure to keep track of when you need to receive each dose of the Recombivax Hb syringe. Ask your healthcare provider about the recommended schedule and mark it down on your calendar to help you remember. This will ensure that you receive the full benefits of the vaccination. It is important to store Recombivax Hb syringe in the refrigerator and not freeze it. It should be kept away from children and pets. When it is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Avoid flushing it down the toilet or pouring it into a drain, unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.